Oh, hi today. It's a bit late today. It's the 12th of March today. Apologies if the video footage is not as good as I'm on my other phone. In my last videos I said I would be doing some more updates, and I did say and state in my comments that I will be turning up the wick concerning the failings in mental health Devon Partnership Trust in Exeter. This video is about that. You know, the people of Exeter with mental health issues, diagnosed with mental health conditions, you know all full too well what's going on in Exeter with the inability to gain access to help and support, even though you've been diagnosed with a mental health condition of severity, and also you're on a regime of medication for your mental health condition, yet you can't access services. Anybody who's watching this video, please do your research with places like national newspapers. Do searches on Google, because you will find the truth there. Devon Live in particular, if you look on Devon Live or you use it as part of your search engine, it will come up with lots of damning reports where people with mental health issues under mental health in Exeter Devon Partnership Trust, which involves this main building. It involves a place of safety around the corner, and it also involves if you're being detained in the Cedars unit, which is over the way. These reports are damning. They are concerning. Obviously, for legal reasons, I can't name patients or families. That would be unjust and unfair. I'm sure they've gone through enough with their loss. You know, there's been a lot of deaths in Exeter concerning these units here in Exeter. You've only got to read the reports. Some of these reports, most of these reports in fact, are quite damning. These involve the tragic loss of life in Exeter concerning mental health patients who have been sectioned or as an outpatient at CMHT. Coroner inquests and coroner reports that this service in Exeter are failing people on a huge scale. There are many families who've lost members because of basically the lack of care, whether they're detained in the Cedars unit or whether they're under the services as an outpatient, which is secondary care. Primary care is when you get shunted back to your GP, which I have been. Yeah, it's a hard subject to talk about, so I'm going to try to be careful. I need to protect other people in this, families, said people. So I won't be naming anybody, nor will I name them in the future. You need to do this research yourself, and you will find what's going on and what's took place. There is an underlying failure in mental health in Exeter. I'm sure this goes on around the country, but I'm obviously focusing on Exeter because that's where I am based. Tragic incidents of failure from the staff. Awful care of people while these people are vulnerable in their care. Borderline abuse, basically. You know, I know this. I've been partially victim to this myself in the place of safety. I know what goes on. It's absolutely horrific. There's been a recent case of a said person. It's took a number of years for the family to try and get some answers, which has come through a medical coroner inquest into their deaths while in the care of these people in Devon Partnership Trust and the Cedars, which is over that way. It just begs belief. You know, this has to stop. You know, how many more lives will have to be lost before someone actually wakes up and goes, there's a problem here. It needs to be investigated properly from a governing body higher up than anybody here. It's got to stop. It's making me very angry, very bitter. But I'm trying to keep a lid on my own emotions. I'm going through an horrific time at the moment. I am being shunted from one in tray to another. I am being in a situation where there's no hope of any help. I have little self-worth in myself. I submitted myself to my GP this morning. The lady there is very nice. It's not her fault, I must state that. They are in a very difficult situation. They don't have a lot of resources or direct channels they can use, because the way this system in Exeter is structured, they're powerless as a GP. You know, I'm not going to name any GPs because that would not be right for me to do that at the moment. But this place will be named. I've had to turn the wick up, and I will continue to do so. You know, some people have criticised me trying to promote the channel for myself. I'm not interested in myself. I'd like to get some help, but I'm not interested in myself. It concerns me deeply. It's very upsetting that I read these horrific losses of life under these people. It's very, very upsetting. So my first strike this evening will be, I am compiling a list of said doctors and practitioners. I am naming these people, although I will not be naming them on my videos. If you're watching these videos, I am compiling a list about the said people. You know who you are. And I am forwarding it to the Care Commissioner Board for Mental Health and Health in general. You have been, as a department here, pulled over by this department, the Care Commissioner for Health, which covers mental health, many times. And many times you ignore guidelines. So I'm compiling the list of the said doctors up here who I have seen, the said psychiatric doctors and psychologists who I've had dealings with, and I'm sure many other people have had the same results from these said people, and I am forwarding it to a higher body. You know, I don't take this lightly. I'm sure in a minute I will get pulled over the coals for doing this, possibly even threatened and picked on and judged for my actions. But I have a right in this country, like so many other people are being failed. I shouldn't have to beg for help. I've been diagnosed with conditions. I am on mental health medication. I shouldn't have to be bouncing off the walls for help, and I shouldn't have to beg a service for help. What this will do to a person is totally destroy them. You will become utterly in total. You feel like there's no self-worth. You will feel discarded and abandoned by these services, which I do. I am so angry. So I am naming you, said people. I hope you watch this video. I am sure members of the team in this department in Exeter at Devon Partnership Trust have seen my videos. I am sure they know who I am. They have identified who I am. I'm not identifying myself. I don't need to. It's my right to have silence. But I'm sure you're fully aware who I am. And I challenge you. I utterly challenge you. I have a right to complain about your service, and I will continue on this path. I'm sure I'll get threatened to remove my page. I'm sure my page will get reported. I don't care. If you report me and you report this page and it gets shut down, I have the video content. I will simply re-upload these videos to another channel or another website of my choice. I will continue to make these videos to expose the truth. I have had enough. And I speak for many people in my predicament. The problem you have and you face as a patient with these vile people here is if you tragically end your life because you feel utterly discarded from society and utterly discarded from seeking help or being able to be put on a path to seek an action plan to help you, if said people or myself end my life because of the utter distress I am in. You know, it's easy for these guys. They would just discard you as deceased. You become a statistic. I accept my fate. But if that happens, I have family members who will pursue this to the end of the line. I'm not threatening anybody. I am voicing my honest opinion of how I feel. And this is how I feel to judge these said people. The said people I will name and report tomorrow in a list. You should be ashamed of yourselves. You know who you are. You hide behind your position of so-called alleged power within mental health services. You hide behind this building. It's my intent to expose you for what you are. You know who you are. And this is my action plan for today. Unfortunately, this place will paint a picture that there's plenty of help and support. It's not true. I plead with people to do their research. If you're in mental health crisis and you're in trouble with your mental health and you're struggling, do the research. It's there for you to find. It's damning and it's shameful. I know I'm not alone in this. I beg people to speak up. Either do similar videos or pass comments. I've had a few comments now which agree with me. My plight here is justified, and I will continue on this path. I will call this video a wrap for today because I am so angry, so cross. All I can say is to the said people who've lost people, I am so sorry for your tragic, heartbreaking loss within your family, because simply the services here in Exeter failed your relatives and failed you as a family. I am truly sorry that people have to go through this.